So next, we would like to talk about thyroid drugs. So this is under endocrinology, and we have thyroid hormones. And so first, we will begin with talking about this drug called levothyroxine sodium, okay, also known as thyroxine in short, thyroxine. So basically, thyroxine is just this drug is just synthetic thyroxine. So it acts like how thyroxine acts. The indications are firstly hypothyroidism. So we have low thyroid level, hypothyroidism. Secondly, diffuse non-toxic goiter. And thirdly is thyroid carcinoma. So when you have hypothyroidism, so we need to top up, or we need to add more of the thyroxine to the patient. So we give synthetic thyroxine. And then you have non-toxic goiter and thyroid carcinoma, or cancer of the thyroid. So preparations and dosage. It's available in they are only available in the tablet form. So what are the side effects of L-thyroxine or levothyroxine sodium? And these adverse effects usually only occur when there is an excessive dose or an overdose. And so what you can have is many adverse effects that are related to the cardiovascular systems. You have arrhythmias, palpitations, so abnormal rhythm of the heart. So it's not the rhythm doesn't it's not normal anymore. You have palpitations, your heart goes very fast. And then we have skeletal muscle cramps and also weakness. So we have weakness and cramps of the skeletal muscle, and then you can have vomiting, diarrhea, okay, tremors, and also some patients develop restlessness. They become restless. Some might develop headache. Some develop fever, so the temperature goes up. Some will have flushing, sweating, and then excessive loss of weight. And some also develop anginal pain. Okay. So you develop pain that looks like angina. So pain that is related to the heart, and also so you develop pain sometimes, okay, where there is latent myocardial ischemia. So mainly you have problems with the heart, okay, potentially arrhythmias, palpitations, inguinal pain, and then you have some CNS symptoms such as tremors, restlessness, headache, okay, and fever. And then you have some systemic symptoms also, like loss of weight. Um, you develop flushing and you sweat, and some GI symptoms such as vomiting and diarrhea. So these are the GI symptoms. And also you have some muscle issues like cramps and weakness of the muscle. So these are what happens when you have an overdose or a high dose of levothyroxine sodium or thyroxine. So contraindications include when patients have pan hypothyroidism. So meaning that we have pan here means across all. Okay, so it involves all the pituitary hormones. So they are all hypo. It's all low. Okay, so when you have a low secretion or discharge of the pituitary hormones, so then you shouldn't give um, levothyroxine sodium. And also when you also have to be cautious when patients have a tendency for adrenal insufficiency. So when a patient develops tendency for adrenal insufficiency, then we might have to be careful with giving patients thyroxine. Sorry, this is just not contraindications per se, but also cautions. Okay, cautions. So we're mainly talking about cautions actually. Okay, now, and another caution is we have to start low. Okay, start low in the elderly or patients with cardiovascular disease. So patients with cardiovascular disease and also the elderly, the aged, in the aged population, you have to start the dose low. Also be cautious in patients with diabetes, and you might need to increase the dose of anti-diabetic drugs, including insulin. So if patients are diabetic, we might need to increase their insulin levels. Okay. So contraindication, it's contraindicated in thyrotoxicosis, obviously. So someone has so when has someone has got thyrotoxicosis, so they have excessive in the thyroid hormones. So obviously you don't want to give thyroxine, which is going to make things worse. So it's contraindicated in patients with thyrotoxicosis unless the patients are on unless the patients are also given carbimazole, which is a drug commonly used for thyrotoxicosis. We'll talk about carbimazole in the probably the next series of mini lectures on the drugs for thyroid problems. So we will see you people in the next presentation.